Hi, my diamonds, it's your girl Fina Diamond. So today I am back again with my very good friend Tara. So he's a first aid tutor and he's here to help us today. So what he'll be teaching us is something that is personal to me. Like, I begged him to come do this because my brother passed away 2019 and he had a car crash. To me, I felt like someone would have helped him if they know of first aid, if they have the knowledge of first aid. But because they didn't know much about first aid, not really they didn't know much, they knew nothing about it. And when I asked them what they did to help, they said they started punching him, and that wasn't the right thing to do. So right now I want her to help us and guide us through what to know about first aid. Like, he's going to be taking it series by series, so I will try and make a playlist on everything he's going to be teaching us. So today he's going to be telling us what he'll be teaching us today, and I will let Tar do his job, and I will just watch and learn more. You know, knowledge is something that you learn every day. Even if you know it, you refresh your memory. So I did the course with him in September, and that was when I begged him to come help us with this. And so let's refresh memory. So Tar, the floor is yours.
Hello everybody, my name's Tahir. I'm a first aid instructor, tutor, however you want to call it, and I've been teaching people for years and years. So I'm bringing you the benefit of my experience. My latest choking experience, unfortunately, was quite tragic, exactly because people didn't know what to do or don't realise the implications. Having skills is great, but being able to use those skills and apply them effectively is another matter. I'm hoping to give you strategy and confidence. So feel free to replay the video, feel free to ask questions. We're here to help you, and we're really looking forward to you gaining competence and confidence in those skills so you can help the people around you, or maybe you can even tell the people around you. The message is more important now than ever. Especially perhaps across the world, there's varying pictures with ambulance services. So today we're having a very difficult time with ambulance services, and they might not be there on time. So let me introduce you to Annie.
And even in Africa, we don't even have ambulance services. Maybe we do, but it's not something that is open to everybody. So this would be like the best time for you to know a little bit about it.
Yeah, so you take on the role of the ambulance personnel to an extent, and although the techniques that I'm going to be showing you are very simple, trust me, they're very, very effective. Literally, somebody who's choking is potentially going to die in 3 minutes. That's all the time that you've got to make sure that they're alive. Now, you come up with the right intervention, they're not dying at all. That's a complete cure. That's without medication, without anything other than the knowledge that I'm about to give to you. So let's begin. This is Annie, as I said, and any of you that have done any first aid training will be familiar with Annie, and there's a story behind Annie which I might tell you in one of the videos that we, or one of the transitions that we do put across to you. So first thing for somebody that's choking, so if you understand choking, it's obstruction of the airway. Whether that's a child that's put a pen lid in their throat, or an adult that's put a pen lid in their throat, or choking on food. Remember the behaviour of a choking person. They go very silent. If they're in a social environment, they tend to get up to go to the toilet because they're very embarrassed about choking.
That's true.
Stop them from going. Okay, just tell them to stay where they are and encourage them to cough. So really, there's not a lot for you to do. In January last year, I did exactly that. It was somebody who attended a course and started choking on a sweet, and they tried to leave the room, and I told them, you're not leaving the room, just try to cough. And about maybe a minute later, they coughed the sweet up, and everything was fine. So just you speaking can be life-saving. You're encouraging people and reminding them to do the right thing. So encourage them to cough, and it can work. The time you know it's not working is where they go from a cough to they can't get anything in or anything out. So at that point, you'll hold the shoulder, lean them forward, and between the shoulder blades, you'll be doing up to 5 back slaps. There's no fashion to it. You don't have to make it trendy. It's just a blow to the back. So you're compressing the air in the chest, and hopefully that will force the object out. So it's a direct blow. The first one can be gentle, but after that you need to be more persuasive. That's 2. Now if it's come out on 2, you're not going to repeatedly hit them. It's not a revenge, it's a rescue. So it's 2 if to remove the object, but if it doesn't, then you're going to go 3 and 5. And as you can see, I'm not really worried about how much force I use.
Yeah.
The injury, any injury that you cause, they've got many years, months, weeks to recover. Choking, they've got 3 minutes. So you really need to get your priorities straight here. Okay. If you don't have a lot of strength, then maybe this is the point at which you recruit somebody who's got that strength to be able to give really effective back blow. But very light back blows, on a mild choking, yes, it will work. On a severe choking, it's not going to happen. And so the last choking victim I came across, the people dealing with him beforehand had not given effective back blows, and we had the wrong outcome.
Wow.
So it's really important that every stage is effective. It's not just let's go through the motions. Yeah. It's got to be effective. It's got to be proportionate to the person that you're treating. Okay. So if the back slaps have worked, you've done the job. Well done. Great rescue. Okay. So you can pat yourself on the back, but not as hard.
But what about if the back slaps don't work?
Now, if the back slaps don't work, you're in trouble. So the best thing that you can do right now is call an ambulance. So where you've got an ambulance service available, you're dialing 999, or in this country, but in other countries, you have your own emergency code, yeah, or use whichever means you can. But they need help fast. Okay. You're going to go to a more aggressive technique, which is called abdominal thrust. Now, with abdominal thrust, it's really important that you understand that it causes and has the potential to cause internal damage. So anybody you give abdominal thrust to must go to hospital. You must get them checked to make sure that there's no damage. You must use the correct technique. Too many times on television, even when the medics are demonstrating, I've seen the wrong technique. So there's an exact technique for abdominal thrust. So I'll stand up so that you can actually see what I'm doing. So I think that's about the right level. So look, can you see how the hand is? The knuckles are pointing to the chin, okay? And the thumb is on the inside. If you put your thumb in the way, it will hurt you. So you're doing this, and you're going to go in and up. So many people make the mistake of just going in, other people just try to go up. It's a combination of the two. It's 1, 2, 3, 4, 5. So the first one was just a demo, and then I did 5 actual ones. Now again, if it comes out on the first one, you're not looking to do any more, you're just going to sit down and wait for the ambulance. So sit the casualty down, wait for the ambulance to arrive and monitor them. But if it doesn't come out, you've got 5 abdominal thrusts. If that works, great. If not, you will alternate. Back slaps, abdominal thrust, back slaps, abdominal thrust, back slaps, abdominal thrust. It could happen that the person that you're treating is taller than you. Or maybe you can't get your arms around them. So there's another way you can do this. So you can lay them on their back. People that are choking don't have a lot of energy. So if they have not got a lot of energy, they're not really going to be complaining. You can move them, they'll move. So look, I'm supporting the head here. Now roll them towards me, and I'm doing back slaps. If it works, great. If not, you lay them on their back, and then both your hands are going to be here. So look, my fingers are going to be pointing towards the chin. Now I can't do both hands because I'm holding Annie up with the other hand. So I've got both hands now, and then and obviously the casualty is on the floor, and you're pushing up toward the chin. This is not on the chest, it's on the abdomen, your heel of your hand just above the belly button, so you can push. So the people who have got a taller casualty or a bigger casualty will find this easier, and some people just find they can apply more strength and more energy to the technique if that casualty is lying down. So you're going 2, 3, 4, 5. So then you just repeat, rolling them towards you, 1, 5, and then you put them on their back and do the abdominal thrust. And then keep alternating between the two. So that's the correct technique for somebody who is choking. Notice that I didn't have my fingers in their mouth, and that's very dangerous. People who have a lack of oxygen, their teeth can clench together. If your fingers are in the way when the teeth clench together, it can cause serious problem for you. I mean, you're not seeing those fingers again until it comes through the system. So good luck with that one if you want to go fishing there. Yeah, it will.
By the time you get it, it's gone already. It's damaged. So.
And also remember that the techniques that I've shown you right now are only suitable for over 12 months. Under 12 months and pregnant casualties, you can't use that technique. Okay, so if I've got a baby available and baby saying I like big naps, I cannot lie. When you're holding the baby, okay, don't hold the baby like this. You'll be holding baby properly. So look, I've got my hand there and I'm pinching the cheek so the object can drop into my hand. I then do not need to keep checking whether the object has come out. I just pinch the cheeks and the object will drop into my hand, hopefully. And the head has to be lower than the bottom. Okay, but if I do that, the baby will be out of shot in the camera. Okay, notice I don't have my fingers in baby's eyeballs or up their nose or anywhere else, and I've left a great big gap between my hand and their mouth. Now, I've got the baby's head low on the bottom and I'm going to do back slaps this way. Why am I doing it this way? Because if I go that way, baby's head gets squashed. Okay, so we're here and it's nice and gentle and maybe it'll come out. But if it's not, if the object has not removed, the food, whatever it is, has not removed, it's a bit more. 2, 3, 4, 5. The most common question that I get here is, it's a baby, I don't want to be hurting the baby. This baby has 3 minutes to live. Now, I've used choking technique on every age group possible that you can imagine. Okay. And on many of those occasions, I've had to be a bit more aggressive, but it's always worked on back slaps. The last one, unfortunately, I got there maybe through the 999 system. I must have got there maybe about 40 minutes after collapse, and that's, given the 3-minute rule, that's too late. But that's just what the system out there is now. Okay, so there were no ambulances available for this person, and then they alerted me. But by the time they'd alerted me, it was too late, and obviously by the time I got to the casualty, it was too late. So we've done our 5 back slaps. We're calling an ambulance because the back slaps have not worked. If they have worked, you can stop there. Put the baby on its back. So you're holding the baby again, you're fully supporting the baby. Better to do it with the baby on the surface, but obviously I've got to hold it up so that you can see. 2 fingers between the nipples. Now this is a life and death technique, because you can interfere with baby's heart rhythm if you are not doing this correctly. So your timing has to be perfect with this. So you're pushing onto a beating heart, put 2 fingers between the nipples, push, wait for 3 seconds. And it's not 1, 2, 3, it's a long 3 seconds. So do the slowest count that you can imagine. Okay. And then you push and wait for 3 seconds. So if you can hear that rush of air.
So with this one you're using 2 fingers?
2 fingers only, yes. Okay. Because it's a baby and we're accounting for the size of the baby. And then you're waiting 3 seconds. Now we're going to do 5 repetitions, but we're waiting 3 seconds between each one.
3 seconds, remember.
So notice that I'm really taking my time because I want their heart to keep going. And hopefully it pops out, and now I'm going to take them to hospital to get them checked. But if not, I will be repeating the back slaps and the chest thrust until help arrives or the object comes out. So that's a fairly good underlying principle of how to treat casualties that are choking. Obviously, in a further instalment, we can talk about, well, what if that choking leads to somebody that stops breathing? But I'm fairly determined to make sure that we keep this very bite-sized so that you can take time, understand it, ask questions.
Yeah.
And if I don't answer the questions today, or we don't answer the questions today, then the next time we'll pick it up and answer your questions
before we start the next one.
Yeah.
So how we'll do it, ask all your questions, and then before we do another video, Tal is going to answer all your questions before he dives into another video. So that's why he's going to make it short now. At least now you understand how to help someone that is choking as a baby and an adult. So we're going to stop it here, and next time any of your questions he's going to answer it, and then we carry on from there and we continue this series. So Tal, thank you so much.
Thank you for listening and watching and joining us, and I hope you join us for the next one.
Yeah. So please don't forget to share this video, like and subscribe to this channel. Tal will be coming here to give us his knowledge, guys. I went to this guy's course and I was like, no, definitely. And thank God he's here today. He's not my making ball. Thank you so much for coming here.
You're very welcome. You're very welcome.
Yeah, so guys, we're going to leave it all here and catch you guys again in our next episode. Thank you so much. Bye.
Bye.
Bye. Thank you.